Clerk will read the caption to House Resolution 915.
House Resolution 915 by Representative Nimmer of the 178th, Shaw of the 176th, LaRicchia of the 169th, Corbett of the 174th, and Spencer of the 180th. A resolution recognizing telehealth as an important tool to improving access to health care in Georgia and for other purposes.
Chair recognizes Chairman Nimmer for an invite resolution.
Good morning, and thank you, Mr. Speaker. Ladies and gentlemen of the House and attendees in the gallery, I appreciate the opportunity to come up, and your attention this morning is we have a special presentation and a recognition to a group called Georgia Partnership for Tele-Health. This group is Georgia's statewide nonprofit telehealth network that resulted from a vision back in 2004 to reach the rural parts of this state with the most advanced and modern day health care provided. This effort resulted in over 550 telehealth sites who have partnered with GPT, that is Georgia Partnership for Telehealth, and connect through this robust network that has been developed. Partners include public health offices, urban and rural health systems, skilled nursing facilities, public schools, jails, and clinics of every kind, from behavioral health centers to primary care offices. Here with us from GPT, which is Georgia Partnership for Telehealth today, are CEO Renea Brewer and Salima Salgado, which is the Director of Telehealth. And Mr. Speaker, I'll allow them to come up if that's fine.
Thank you, sir, for letting us be here today. Thank y'all for letting us come. We like to come every year and demonstrate telehealth, and appreciate your attention and appreciate all you do to support telehealth across the state. We should all be very proud that Georgia is leading the way with telehealth. We have one of the most robust telehealth networks in the country, one of the largest in the country as well. And of our 650 sites, 550 are here in Georgia. Without our partners across the state, though, we couldn't do this. Georgia Public Web has certainly helped us today, and they are a partner with helping us deliver this health care across the state in these rural communities. But we have many partners. Department of Public Health is one of those partners, and Salima Salgado is the director of that program at DPH, and she's going to help us today with one of those partners of ours down in Valdosta at DPH. So Salima, if you'll come up.
Thank you, Rena. Again, I'm Salima Salgado, the Director of Telehealth and Telemedicine for the Georgia Department of Public Health. And so thank you so much for allowing us to be here and also show you. Through collaboration and partnerships, the state dollars are being used for telehealth and telemedicine in partnerships with universities, private hospitals, and through the partnership through telehealth, we were able to connect virtually for specialty care services for pediatric and adult services through our 159 county health departments. So today I'd like to just connect with Sandy Simmons all the way down in Valdosta and let you see a virtual connection. She will be demoing you a pediatric children's healthcare kind of connection where we connect back to pulmonologist or endocrinologist here in children's all the way from Valdosta. So with that, I'll turn it over and see if we can get Sandy on video. Go ahead, Sandy.
Okay, hey, my name's Sandy Simmons. I'm the nurse coordinator with Children's Medical Services, and our program provides birth services to children birth to age 21 with chronic medical conditions or special health care needs. We are programmed through public health, and with that we actually have nurses that provide care coordination to ensure that these children are receiving the medical care that they need. We can financially help families if they need help paying for medications or supplies or equipment that say their insurance would not cover, or if those that are uninsured, we can help assist those families. We are located in rural Georgia, and we do not have access to a lot of pediatric specialists here. Most of our pediatric specialists are located 4 hours away in Atlanta or Augusta. And sometimes that can be a hardship on families down here. Many of them don't have transportation that will actually get them 4 hours away, or financially they don't have the funds to be able to provide gas in their car for those long trips. So Telemedicine has been wonderful for our families down here. We actually, through our office, we provide 5 different specialty clinics that include endocrine or diabetic clinics, genetic, sickle cell, hematology. We do nephrology, and we also do pulmonology with 2 different hospitals. We do Children's Healthcare of Atlanta and actually Augusta University Children's Hospital. So we have 2 different places that we do connect for pulmonology. We actually, that since July 1, our fiscal year, we've actually have 40 days of telemedicine clinics, and we've seen over 272 children in those clinics. So normally when the child comes in to see the provider, this is what they usually see. The provider is what you're seeing. They'll see me and the child on this and talk to the family, get a history, discuss problems, and then they'll tell me to go ahead and do an assessment. So that's what I'm going to do right now, and you'll see everything that the provider would see. I'm going to flip the screen a little bit. So I normally start with heart and lung sounds, and my stethoscope's Bluetooth. They have a stethoscope just like this on their hand, and then we listen to the heart and lung sounds. Take deep breaths. Good. And this is Isabella. I don't think I introduced you to her. And then we'll listen to the back. The stethoscope sounds amplified. It actually sounds better than what you would normally hear. Stethoscope. We've actually picked heart murmurs on children, and we can always hear if they're wheezing or coughing or short of breath. So I'm gonna let you turn around and look at me. We're gonna do your mouth first. We're gonna go to our scopes, and we're gonna get Isabella on the screen. Good. Hold on just a second. Don't tilt your head back so you can see. All right, open up you. All right, say ah. A little bit more. Here we go. And this is our general scope. So actually, if there's other things, if the doctor needed to see something on the skin, sometimes we'll look at eczema or rashes and use this scope for those type of things. Then we just change our lens, and then we'll look in the ears. All right, you ready? You done just a little bit for me. I can get right here. You have to lift up our floppy ears. And then there's our one ear, which as you can tell is much better to be able to see an ear magnified than use an otoscope in an office. And then you can see here, and you can see her ear. And then we're going to tilt your head back just a minute, and then we're going to look into our nose. Just tickle a little bit. And we'll look there. And then one more. And then if there's anything else the doctor needs to look at and see, then we'll finish up. Otherwise, the doctor and the provider and the family can just discuss whatever's going on and change treatment plans, and then we're done.
Thank you so much, Sandy. Thank you, Isabella. Enjoy your 100th day of school. She's dressed as a Dalmatian because it's the 100th day of school. Thank you.